Hi everybody, it's Ed O'Keefe and welcome to another episode of America's Leading Experts. I'm here with Dr. Conrad Tamea of Biohealing Orthopedics. I'm super excited because this is my first time having an orthopedic surgeon to talk about the advancements in regenerative medicine, stem cells, and we were talking before we came on the show, and you have a lot of great stories already. We should have been filming the whole time.
Well, yes.
Well, welcome to the show. Thanks for being here.
Oh, well, thank you. I'm privileged and honored. So, yes, I am a board-certified orthopedic surgeon. I achieved that status in 1979 when I finished my residency, and I practiced operative orthopedics until 2004, at which time I kind of retired. I'd like to say that I finished my work in that field, and I stepped away from it, and I moved from West Virginia to Florida at that time. And as a year or two rolled by, and regenerative medicine was making its debut or becoming quite popular, this was in 04, I became quite excited about that. And I jumped into it with both feet, and since that time, regenerative medicine has evolved. And it's evolving today as we speak, and it's a lot to keep up with. But the enormous benefits of regenerative medicine to a person with an orthopedic illness, although we do treat other illnesses, but we'll get into that if you care to. The great advantage of regenerative medicine is that a person with a rotator cuff tear, for example, can get back to work in a couple weeks, whereas if surgically they would require months of rehabilitation with a marginal outcome, because there's probably a 20% failure rate with most orthopedic surgeries. Right? Yeah. So we get a prompt response, and generally speaking, it's a favorable response. I'm passionate about what I do.
Well, I was going to ask you, can I ask you this question? Like when you took note of, like, what excited you about what you were seeing? I mean, being classically trained as a board certified orthopedic surgeon, and then this new thing comes around that most traditional MDs are just going to ignore. So what excited you about it? What did you see?
Well, you've opened up a lot of ways for me to answer that question. And I retired at an early age, and I was kind of looking for something to do, and I came across some folks who had been on the ground level of regenerative medicine, and I became quite fascinated with it, and it has evolved since that time, and I've subsequently become even more passionate about what I do because the enormous benefits that I can deliver. Just to mention a couple,
I'd love to hear more examples. That'd be great.
I had a collegiate pitcher come down from Toronto last week who was suffering from a shoulder injury, and the name of the shoulder injury turned out to be a labral tear, which is common among pitchers, and this guy's a 17-year-old pitcher, and they're prone to shoulder and upper extremity injuries. So he came down from Toronto, and we treated him last week, and I talked to him yesterday on the phone. I expect him to take a 12-week recovery because we have to have tissue healing, not just pain relief, and I really expect him to do very well. We've taken care of numerous professional athletes, the most notorious of which, I will say, is a fellow named Sudden Sam McDowell.
Okay.
Now, if you're a baseball fan and you were active in the late 60s and early 70s, you'll know that Sudden Sam was the fastest pitcher in the major leagues, and he was faster than Koufax, and he won numerous awards throughout his career, and he's a legendary pitcher, and he came under our care I'd say about 3 years ago, And at that time, his back was against the wall. He couldn't take care of himself. He could hardly walk across the room. And not recently, but within the past year, he completed a major tour throughout the United States to market his book.
Is that right? Yeah.
The Saga of Sudden Sam McDowell. Look that up.
The saga.
The Saga of Sudden Sam McDowell.
Okay, I love it.
So he had bad knees, and additionally, and surprisingly, he had bad lungs, okay, chronic obstructive lung disease. And we treated him for that, and his breathing is normal. He's not on oxygen. He doesn't need his CPAP.
That's unbelievable.
But it doesn't stop there.
Okay.
Yeah, he's my superstar patient. So not only was his superstar pitcher, but, and he remains.
Can I ask how old was he when he started seeing you?
Well, he's probably 85 now,
Okay.
and so I first probably saw him around at turn of the 8th decade. And not only that, he was diagnosed with thyroid cancer.
Oh, wow.
During the COVID epidemic. And he was treated with a surgery. He had a radical neck, a semi-radical neck, and then he had radiation. And his doctor said, "I've done everything I can for you," and discharged him. So he came to see me. I had already known him, of course. He came to see me, and we treated him 2 or 3 times. And then when he went back to his internist, the nodules in his thyroid had shrunken 50%.
Is that right?
And I want to make one thing clear.
Yeah.
I do not profess to be able to treat cancer, okay?
Okay.
But
Okay.
we treat a lot of patients who have cancer because, like I said, their back's against the wall, they can't get out of bed, they can't take a shower, they can't breathe. And these are all the things that we can substantially improve the quality of life.
Well, I mean, one thing that happens obviously is that, like, as you, like, with if my knees are at a place where I'm not mobile anymore, then I'm not getting out and doing anything. You'd probably see this with a lot of different people as they age with just different injuries and different pain. But I don't want to go away from this this story first. But so he had bad knees, COPD,
And thyroid cancer.
that's unbelievable. And he's just did a full tour around the States on his first book.
I was at his house last week. He threw me a birthday party.
Oh, is that right?
Yeah.
That's right.
His wife is,
Yeah.
I call her the chic, Czech chef because she fixes a marvelous dinner, and she's from Czechoslovakia, and she's chic.
Okay.
So
Nice.
that's my special name for her.
Okay. Okay.
It's hard to say.
There we go. Yeah. So for your nowadays, what are you seeing most? Is when patients are coming to you, what types of symptoms or injuries and conditions, especially for our audience to know where, if they should reach out to you guys to see where they're experiencing different types of injuries or pains?
Well, generally speaking, we are treating orthopedic injuries. So that would include the shoulder,
Yeah.
it would include the knee, it would include the ankle, it would include the elbow, and then the spine as well. So each of those areas are why people go to see orthopedic surgeons.
Right.
And the majority of patients that come to me, they may or may not have seen an orthopedic surgeon, but they say, I don't want to have surgery.
Right.
Maybe they've had a total hip on the right, which didn't turn out that well, let's say, and now their left hip is bad, and they just don't want surgery, so they come to us, and we give them a very thorough evaluation. We get an MRI if required, plain films, and of course physical exam and history. We go through. I typically will spend about an hour with a new patient and really get down to the heart of the matter, what they want, and so forth. And then we'll make a treatment recommendation. And so the majority of my patients now are, I'll say, run-of-the-mill orthopedic injuries.
Okay.
Yeah, shoulder, knees, hips. And as the field of regenerative medicine evolved, becoming much more efficacious, we have branched out, like I said, into chronic obstructive lung disease and neuropathy. And we're making major advances in neuropathy as we speak. So,
When you're saying efficacious, just so for our audience, that means that there's more and more data and research showing that stem cells are creating positive outcomes for things that normally would never be treated with regenerative medicine.
right, that's correct. So the products are evolving with a higher degree of potency and effectiveness. Yes, so.
Can we define like what are stem cells, and then why is it important or why is it almost like fountain of youth, I can say that, for borrowing it as we age? Why has it become more important to?
Well, you know, that's my favorite question, so thank you. Yeah.
Well, I'm glad I asked.
And I've got a favorite answer for that, and now you're going to hear it. So the best way to heal the human body is to use the healing products of the human body.
Love it.
So a stem cell is the vital part of our body, and we've got like billions of them floating around, and they repair. When you wound yourself or when you become sick, the stem cell rushes like an ambulance to the scene of the crime and begins the reconstruction process, which drills down into a lot of biochemistry, but we won't do that at the moment. But so the stem cell is the building block of the human body. Let me give you another one-liner here.
I love it.
Okay, so you're married, you got kids,
I am.
and you know what an umbilical cord looks like.
I sure do. I
Yeah, right. So through that little umbilical cord passes an entire human being in a matter of 9 months. I mean, have you ever thought about that?
It's pretty amazing.
Yeah. So ragu spaghetti sauce, it's in there, okay? It's in there. And the Native American knew these, and most ruminant animals, horses and cows, they know this. They eat the placenta, for example. And so this is not a new revolution. It's as old as traditional medicine. But yet, in this day and age, we have researchers and companies that are producing highly refined forms of stem cells. One being exosomes. The exosome is the signaling mechanism of the human body. When you go to the bank, you put your little deposit slip in the canister and it goes, well, the canister is the exosome.
Okay.
And you are the origin of the stem cell, and the teller is the person that needs to be treated. So your body sends these products to the area that need treatment. That's occurring in your body as we speak. So we're helping the natural process along. And because I think you said that as we age, unfortunately, our stem cells kind of drop off the cliff somewhere around the age of 55 or so.
Yeah.
And so that's why a guy my age won't heal as quickly as a 6-year-old or something like that. But anyway, does that answer your question, sort of?
Yeah, I mean, it's exactly, well, it's for our audience to know, like, the reason why stem cells can come in and just create a surge of healing, whereas without it, it's not happening, is because you're borrowing the power that made the body to actually restore it and heal it, correct?
Thank you.
Okay, there we go. Yeah. Well, no, I think it's so important because especially when it comes from an orthopedic surgeon or someone in medical profession, we're finally evolving to becoming more mainstream, but most people don't realize that. I mean, you actually said it, most people don't want surgery, and the way that the traditional medical profession has been built is a glide path to surgery. You just give medications, cortisone shots, and then can't do much more for you, let's get you a surgery. Whereas
Yes, and that's a sad state of affairs in modern medicine. Do I have the privilege of talking about that for just a moment?
You have the floor.
Okay, so as you said, the majority of patients do not wish to have surgery, so it is a major alternative, and a more effective alternative, because the recovery time is typically quicker.
Yeah.
There's no complications. So why doesn't everybody do this? Well, the answer to the question is that the powers that be in our country are spending billions, if not trillions of dollars to stall the progress of stem cell therapy.
Right.
And that would include the CMS Medicare, it would include the FDA, and the pharmacy company. So these companies are making massive investments to prevent these therapies from becoming mainstream, which they fully deserve.
Yeah. Well, this is good. This is a good time too, just to even bring up that. So stem cells is not insurance does not cover it.
That's correct.
That's correct, and this is a good point to bring up, because what I always like to say to people, we have a lot of guests on and we talk about the miracle of stem cells and how people will receive them when they've only been given options and they're back playing pickleball, golfing, walking, doing all their things. But I always explain to people when they say, well, does my insurance cover it? No, it doesn't. But think about, and so when you look at the investment into it, how much you're already paying. No, you've already paid the price. You're paying it every day.
Yeah.
And it's already costing you. And the worst thing it can be costing you is your identity, your tribe, your life, your ability to go do things. And so we like giving people permission to invest in themselves.
Exactly. And people choose the surgery or the pharmaceutical because their insurance pays for it. And they don't have the privilege of choosing what their mindset or intellect would tell them to choose if it wasn't a financial issue. But it is a financial issue. That's a sad fact. At one point, Medicare was paying for stem cell therapies, okay? And that happened for a period of approximately 1 year. Let's just say it ended 3 years ago when they cut it off. They just stopped paying for stem cell therapies. Medicare, we're talking about Medicare, okay? And we treated dozens of Medicare patients with stem cells, and they got better.
Yeah.
And now the Medicare recipients, including myself, we don't have that privilege, which is really sad.
Right. Well, do you mind sharing I'd like to go over a couple more examples of success stories. Of people that come to you use exosome stem cells, and what kind of response and outcome are they receiving?
Well, you keep asking my favorite questions.
I like these questions, yeah.
And so let's take, for example, a fellow, again, from Toronto who happened to be a semi-pro hockey player.
Great, love athletes. And
he sustained an injury to his posterior cruciate ligament in the knee, which is a highly disabling injury, and you cannot compete with a ruptured posterior cruciate ligament. So I had known his father, and this fella came down to me, and I did a thorough evaluation, including an MRI, an ultrasound, a physical examination. And he's a weekend warrior, okay? So he's like pushing, I don't know. I talked to him a couple days ago, because a moment ago I talked to you about the 18-year-old, that's his son, okay?
Oh, is that right?
So that's why his son came to see me, because his dad came down here about 4 years ago. And indeed, he had a posterior cruciate rupture. And so we did a very sophisticated what we call a targeted approach,
okay.
Meaning that we put the stem cells where they need to be. In other words, instead of just blindly injecting the knee or the ankle, we look and see where exactly the problem is, whether it's the cartilage, the meniscus or the cruciate, and so forth, and we target that using ultrasound to put the product exactly where it needs to be. So, long story short, I keep wanting to say his name, which probably I'm not going to do that.
You can always delete it, but yeah.
Yeah, no, I won't. But the truth of the matter is, like I said, because of his son down here, I talked to him a couple days ago, and he's back on the ice playing his favorite position.
They didn't have to do any invasive surgery other than just the needle going in. And
Correct.
that's unbelievable.
So we put him through a 12-week rehab program.
Yeah.
Yeah.
Yeah. And so 12 weeks is nothing compared to, like, that would be a year-long, career-ending, potentially injury.
That's correct.
Yeah, that's right. That's wow. All right, give me another one.
Okay.
I love this because, you know, what's great about talking to you is, like, you're dealing with athletes. I coach, my team won the AAU National Championships just 2 weeks ago.
In what sport?
Volleyball.
Okay.
And so I'm around, and then I'll continue on for the next couple.
AAU championship, first place? What?
Yeah, in the Aspire, in the 3rd division, yeah.
Oh, wow.
But then the last few years my teams have been in the open level, top three. We went 3-3-5 last
Good.
3 years. But a lot of the kids are going on to, they're like kids at Texas, Louisville, and all these other locations. But what I love about what you just kind of opened my eyes to is that you're going to see a lot more athletes and people doing a lot of physical activities. They need to get back out there for more than just their own, you know.
Well, we could lump the patients I see, let's say, just in two broad and general categories.
Yeah.
There's no sharp dividing line, but we're talking about the younger athlete who has sustained a ligamentous injury or a cartilage injury, and he wants to return to competitive play or recreational play. That's one type of patient. And the other type of patient would be the old guy, like me, you know, that's got a bum knee or a bum hip or something like that. And we can get that patient back to a very satisfying and functional lifestyle, like Sam. You asked me about another patient. Well, she was an amateur dancer, but she was a very sophisticated amateur dancer in the villages in Florida, and she had a tear of one of the major ligaments of her ankle, and actually it was a tendon, not a ligament, excuse me, and she couldn't compete. And so we diagnosed the lesion in the usual way, MRI, ultrasound, physical exam, so forth. And we gave her a couple of treatments, and she's back out on the dance floor.
That's great.
Mm-hmm.
Which for a lot of people, the power is not just the healing in the ankle. The power is that I get to maintain my identity of somebody who loves to dance and be a part of that community, the thing that they do with their friends and whatever it might look like. I mean, you know, my parents lived a really long life because they had things to look forward to. And that's the cost of...
Well, that's the truth.
That's the truth, right?
Yeah.
Yeah, I mean, you know, and that's the same thing, though. I mean, so that's what we're talking about, restoring and keeping in their lives.
Right, and that's why I'm 78 and still going strong. I hope for a long time.
But you're also, you know, you have a mission and a purpose.
I do.
You know, and so that plays, you know, Viktor Frankl's book, A Man's Search for Meaning, like, he was in the prison camps in Germany.
Viktor Frankl.
Viktor Frankl. It's a great book, A Man's Search for Meaning. But he had said that if you have a why, you can find the how. And so when we're kind of fed this false beliefs of, well, it's typical, you age, your knees go bad, just deal with it. And that's just not true anymore.
Well, aging is one of the major, and even mainstream medicine is investigating aging, and it's pretty widely accepted that aging is not a normal process, so to speak, that there's reasons why we age. Okay. Now, if I were given the chance, like Dorian Gray, to not age and to live and to look in the mirror every day and see the same Conrad that I saw 20 years ago, that would be a very tempting choice. But in fact, I'm getting off subject here. I'm so sorry.
You're interesting.
But that's not a good choice.
Yeah.
We do, the aging process has certain benefits in our life, and we move from one phase of our life to another phase, and if and when that should stop, then it's not fun. But I digress, and I apologize. So I think, to put it in capsule form, what we can do is to optimize your lifestyle at any given age, whether it's 85 or 18.
Yeah. And the other side of that then is also what, where I want to ask you, you just mentioned something really interesting, is that what is the thing do you feel that most people are surprised about when it comes to stem cells when you talk about them, either their treatment plan, the recovery, and more?
Well, that's kind of a tough question to answer, because most people have a very innocent, I was going to say naive, but that's slightly more pejorative than an innocent viewpoint. And there are some people who view stem cell therapy as an overnight miracle, okay? And that's one of the things that I have to address in the patients that come to me. It is a miracle. Very seldom is it overnight, but occasionally, and there is a rehab process. So it's the innocence of the patient that comes to me, not knowing what stem cell therapy involves, and having heard from various sources, their neighbor or the seminar or whatever, what the potential of stem cell therapy can be. And it's my job to pretty much educate them.
Yeah. Well, we know that some people get improvements rather quickly, and some people it may start appearing a little bit further down the road. But that doesn't mean it's not working. But the other thing that's very interesting is that if it's taken somebody so many years of ignoring a problem or being on meds or and they're having degeneration, it might take a little while to come back. But at least we had somebody in here, we were talking about treating neuropathy, and someone was feeling a little bit of numbness or a little bit of like their symptoms, but they were taking
gabapentin,
something like that, yeah, and so it was kind of masked. They're like, well, it's not too bad yet, and those are the patients you wish you can grab early and start working with them early rather than waiting till it's so bad that they're already facing surgery and now they're coming back to you looking for that instant miracle fix, whereas they could have came beforehand.
Well, that's human nature, but I just want to say that you mentioned that there are two pathways. One is the next day, and the other is, like I said, 12 weeks for our picture. And there's a very substantive reason for that, so that the one component of the stem cell is what we call the cytokines.
Yeah.
And the cytokines either cause pain in your body. When you burn yourself, it's the cytokines contacting the nerve fibers that cause pain. Or a cytokine may be a certain category of cytokine which alleviates pain. So that's one component of the stem cell. And the other component is typically the Wharton's jelly, which is collagen. So in the picture that I referred to, the 18-year-old picture, we have a healing process that needs to occur, which takes 12 weeks.
Yeah.
And in another patient, we have an inflammatory process which can be reversed overnight.
Yeah.
So
You have both sides of it. So if you're going to say, since we're coming to the conclusion of this great podcast, who do you wish knew more about what's available that you guys are offering that if they only knew about it, they would come in and visit you and get treatment? Like,
Well, bring it on, if somebody's got a sore knee and they can't play pickleball, or if somebody's got brain fog from a concussion, or if somebody has COPD, we do think that the earlier you begin, the reversal process is much more different than the arrest process. So if you have a condition that is progressive, we may be able to arrest the process, but the reversal is a little more tricky.
that's okay for a lot of people. They stopping the process or pausing the process or slowing it down.
Right.
Is a big deal. It allows them to keep doing so many things. So what I'm hearing is, folks, if you're out there and whether it's your shoulder, your elbow, your wrist, any of these other joints that are aching, it sounds like you need to find Dr. Conrad Tamea and see what they could do for you at biohealingorthopedics.com. I love it. Okay. At .com. And is there any final words you want to share with everybody before I let you go?
Well, for once, I'm stumped. No, I think we've covered a lot of stuff. I just say that this is this has been such a blessing for me to, at this stage of my life, to be able to embark on a new pathway with a frontier that is the sky's the limit. There's no question in my mind that in 10, 15 years, maybe sooner, hopefully not later, that this is going to be the go-to therapy for the majority of orthopedic conditions.
That's so good. I can see your passion. That's great. It's good to be excited and passionate. It's awesome. Well, thanks everybody for watching. Hope to see you on the next episode, and thank you, Doctor, for being here.
Well, thank you.
It's great.